And I'm going to talk tonight about something that I'm very passionate about and something that affects all of us, because all of us have kids or have grandchildren or are involved in the local community with the youth that we have, and we don't want to see them get injured. And this is really part of a national campaign to help raise awareness about some of the overuse and traumatic injuries we're seeing in our kids and what we can do to hopefully understand it better and prevent these injuries. So why are injuries on the rise? Well, there's insufficient rest after injury, as I talked about. There's poor training and conditioning that we see. There's specialization in just one sport and year-round participation. Those are the major factors. How are kids different? They're not just little adults. Their skeletons are growing. They have growth plates in their bones, which absorb loads differently, which cannot take the same loads as an adult. The ligaments and tendons are also stronger than adults, and that will tend to pull the bone apart. And the other thing which is important is that their brains are not developed. So if they have a head injury, their brain is still developing, and they can't adapt to a concussion or a head injury the same way that an adult can. So there's been a lot of emphasis lately on concussion. Concussion is a process where there's a traumatic injury to the brain. It's a metabolic disturbance that occurs in the brain and the way the neurons that make the brain cells that make up your brain work, and there's consequences to that. There's cognitive dysfunction, traumatic encephalopathy with repetitive injuries, and even death. And Jeff Brown, who's here tonight, I think gave me some great information on this, and he's kind of an expert on this and has a special interest. Jeff, could you just stand up for a minute? He's one of our great pediatric specialists here, and he has a special interest in this, so if you have any interest in this topic, I would encourage you to get in touch with Jeff. But this has also hit the mainstream media and it's on the cover of Sports Illustrated, principally because of the NFL issues where these guys are getting traumatic brain injuries and they're committing suicide, or they have major depression in their 40s. There's one example of a college student who had traumatic brain injury and had basically traumatic encephalopathy and committed suicide as a result of that. So it's something that the brain doesn't take a joke. And there's also something you should all be aware of in kids. It's called the second impact syndrome. And I saw this young boy today. He's 8. He participates in all the park events here. He's a great skier. He's also a gymnast. Fell down, hit his head. And he's still having symptoms several days later. And if a kid is having symptoms, they should not participate in sports. And the symptoms vary. They can be just lethargy, they can be a headache, they can be difficulty walking, and they can be more subtle with just they're not thinking clearly. And kids will get this thing, it's called a second impact syndrome, where if they get hit with another injury, it can even be a minor injury, it can cause basically a fatal injury. And Jacob Snakenberg was actually a student here in Colorado who sustained a concussion in a game, didn't tell anybody, had some minor cognitive deficits, and didn't really report his symptoms to anyone. A week later in a game, he took a hit that was a typical hit. He collapsed on the field, never regained consciousness, and he died from second impact syndrome. So the major way to prevent this really is with helmets, and also not letting kids participate when they're hurt. Prevention is the biggest thing. Appropriate helmet use. Winter sports are big offenders because of the speeds that are involved. Sledding is one of the ones that you don't even think about. Your kids go sledding, they slide down, they plow their head into another kid, they get a concussion. You might not even know what happened. It happened to my daughter this year. Hockey, skiing, snowboarding, we all see our kids now are wearing helmets. Make them wear helmets. We see so many patients come into the hospital who are visiting here or who even live here that are not wearing helmets, that fall down or they get hit and they were skiing in control and somebody collides into them and they get a concussion. Any type of cycling sport, any type of contact sport, really, you have to wear a helmet. And the most important thing with helmet use is to make sure that it fits appropriately as well. Hand-me-down helmets that don't fit well are not going to protect your kid appropriately. So the treatment really, they don't have to lose consciousness either. There's a big misconception that somebody has to lose consciousness to have a concussion. They can just have a bonk on the head, and that can literally create a concussion. The treatment really is rest, and you have to keep them out until they're back to normal. They do some testing in the schools now to try and figure out more subtle cognitive deficits of those kids that are playing in it. I know, JC, that they do at Ski Club Vail with the impact test, where the kids take a test before the season, and then if they have a head injury during the season, they'll take the test again and they can see if they're off their baseline, because sometimes it's very difficult to detect. But if you have any question, you really have to keep the kid out, and now there's a law that actually prevents, which causes that. And this law just came in. It'll be effective next January. It was just passed last week for those of you who may not have seen it. And it's basically based on that case with Jake Snakenberg. And it requires coaches to bench a player when they believe to have suffered a head injury. They cannot go back into the game that day. And it requires also medical clearance from a physician or somebody who's qualified to make a decision medically about them returning to play. And most importantly, it requires an education process for any coaches to take a free training to recognize the symptoms of a concussion, so that hopefully, we won't have kids like Jake Snakenberg in our community. So in summary, with concussion, a player should be removed from games or practice for any signs or symptoms of a concussion, and they may not return to play the same day. And rest is really the essential treatment for this. There are some medical therapies that if it's more severe that some of the physicians may prescribe, but in most cases it just requires rest and prolonged rest in many cases. And the young athletes really are at increased risk for this second impact syndrome, and they must be managed conservatively.